So I have shift report. Are you ready?
I am.
All right. So room 10, bed A, Carol Smith, 36-year-old, full code. She came back from the PACU at 1500. She got a total hip replacement, has a dressing on her left hip. It looks dry and intact.
Okay.
Her lab values are normal. Vital signs are stable. I gave her her last pain medication at 15:30. She has a dressing for an order for a dressing reinforcement PRN. Do you want to go see her?
Yes, let's go.
Okay.
Hello, Miss Carol. My name's Sarah. I'm the new oncoming nurse. How are you doing?
I'm very sleepy.
Okay. What I'm going to do is I'm just going to take a look at your dressing quickly, okay?
Okay.
All right, my dear. Give me a couple minutes. I'm going to go grab this stuff. I'm going to put another dressing right on top of your other one, okay? How's your pain level doing?
I'm okay for now.
So, all I'm going to do is, like I said, just kind of reinforce your other dressing. So I'm just going to put another one right over where it is.
Does everything look fine?
Yeah, you're okay, my dear. All right, perfect. All right. Give me a few minutes and I'll be back, okay?
Thank you.
Hello, Miss Carol. I'm back. I'm just going to take a look at that dressing I just put on, okay? How are you feeling?
I'm still a little sleepy, but I'm okay.
Okay. All right. I'm going to go give the doctor a call and then I'll be back with you shortly, okay?
Okay, sounds good.
Hello.
Hi, Dr. Maya. My name's Sarah. I'm calling from 2 North.
Mm-hmm.
I have your patient Carol Smith in bed 10A. She came to the unit with a left total hip replacement. At my 1600 assessment, I went in and I reinforced the dressing that was ordered, PRN, because it looked pretty saturated. I just rechecked her and the bleeding's pretty heavy. It actually went through and saturated the bed linen. What do you think we should do?
Oh, the bleeding you have described is not excessive, but continue to monitor the patient closely.
All right. Thank you, Dr. Maya.
Sure.
Hello, Carol. How are you doing?
I'm still okay.
Okay. I'm just going to take another look at that dressing we put on.
Okay.
All right. Is there anything I can get for you?
No, I'm fine for now. I'm just very tired, so I'm going to take a nap.
Okay. I'll be back in a little bit. Hello, Miss Carol. How are you doing?
I'm a little cold.
A little cold? Okay, let me take a look at that bandage. Anything else going on? Just feel a little cold?
I'm just feeling really tired.
Okay. I'm going to put a call into your doctor and then I'll be back to check on you in just a little bit, okay? Hiya.
Yes.
Hi, Dr. Maya. This is Sarah calling again about Carol Smith in bed 10A.
Okay.
I'm just worried that the bleeding still looks too heavy to me.
Oh, don't worry. After this kind of surgical procedure, the bleeding is expected, so just continue to watch the patient closely.
Okay, thank you, doctor. Hello, Miss Carol. How are you feeling?
I'm very cold.
Okay.
I'm having a lot of anxiety.
You look a little pale.
I'm short of breath.
Okay, let me take your blood pressure, okay? Let me check it one more time, okay?
Okay.
Take a look at that bandage, too. All right, Carol, I'll be right back. I'm going to go get the doctor to come, okay?
Yes, hello?
Hi, Dr. Maya. This is Sarah calling again about Carol Smith in bed 10A.
Okay.
I'm really concerned. The dressing is severely saturated again. Her blood pressure has dropped to 71/42. She has a heart rate of 140 and her respirations is at 30. She's shaking and she looks a little pale to me.
Oh, God. Give the patient order IV infusion and put her in Trentalsburg position. I'm coming immediately.
Okay, thank you.
All right, I have shift report for you. Ready?
I am. I have our chart all pulled up.
All right. So Miss Carol Smith, 36-year-old, room 10, bed A. She's a full code. She came back from the PACU at 1500. She had a total hip replacement. She has a dressing on her left hip. I assessed it and it looks dry and intact. Her lab values are normal. Her vital signs are stable. I gave her her last pain medication at 15:30.
Okay.
And she has an order for a dressing change reinforcement PRN.
Perfect. I saw that in there.
All right. Other than that, she is alert and oriented ×4. And we started her on the clear liquids, and she seems to be doing fine.
Okay.
Do you have any questions?
I don't. Let's go see her.
All right. Hello, Miss Carol. How are you doing?
I'm good.
All right. So I'm going home now. This is Sarah. She's going to be your nurse for the night.
Okay.
All right. Do you mind if we see your dressing?
No, that's okay.
All right. So she has some oozing, but other than that, it looks dry. Looks intact.
Awesome. Thank you.
All right. Is there anything that we can get for you before we leave?
No.
All right. Well, have a good night.
Thank
I'm just going to go get report on a couple more patients, and then I'll be right back in with you, Carol, okay?
All right.
Hello, Miss Carol. How are you doing?
I'm okay.
You okay? I'm just going to check that dressing again, okay?
Okay.
All right. Give me just a couple minutes. I'm going to go grab some supplies. I'm going to put another dressing on you, and then when I come back, I'll check your vital signs too, okay? All right. So I got my supplies. So like I said, I'm just going to kind of reinforce your dressing. I'm going to put another one right over it just to hold a little more pressure on there for you.
Okay.
How's your pain doing?
I have no pain.
Good. Just put some tape on there. Perfect. And while I'm in here, I'm going to check your blood pressure and get some vital signs from you, okay?
Okay.
And I'm going to check your temperature too. Have me close your arm. Perfect. Do you need anything else while I'm in here, Carol?
No, thank you.
I'm going to leave the blood pressure cuff on you. If you do, just hit the call in and let me know, okay?
Sounds good.
All right. All right, let me just get caught up on my charting. So I need to note that I reinforced her saturated dressing and also that her blood pressure was 110/80, heart rate of 88, respirations at 18, and an oxygen saturation of 96%. Perfect. Okay. Hi, Miss Carol. How are you doing?
I'm okay. I'm a little bit dizzy, but I'm okay.
How long has that been going on?
For just recent.
Okay. Let me take a look
minutes.
at your dressing.
Okay.
All right. I'm going to get your blood pressure and your vital signs one more time. Any other symptoms going on?
No, not really. Just a little sleepy.
Sleepy? Let me grab your temperature too again. All right, Carol, I'm going to go ahead. I'm going to call the doctor, and then I'll be back with you in just a few minutes, okay?
Okay.
And before I do, let me just check. Pulse. No tingling, numb, anything like that in your leg?
No.
Okay. All right. I'll be back with you shortly, okay?
Thank you.
Yes. Hello.
Hi, Dr. Maya. This is Sarah calling from 2 North.
Okay.
I have your patient in bed 10A, Miss Carol Smith, who's here for a left total hip replacement.
Mm-hmm.
I've reinforced her dressing once as it was pretty saturated, and I've noticed that her vital signs are trending down. During my last assessment, she had actually bled through the reinforced dressing and saturated the bed linens. Her blood pressure is now 105/77, heart rate of 92, respirations at 20, and oxygen saturation at 94%. I'm just a little concerned with all her bleeding.
You know, the bleeding you have described is not excessive, so just continue to monitor the patient closely.
Okay, thank you, Dr. Maya.
Sure.
Better document that I spoke to her. Just don't feel like this is right, though. Hi, Andrina. I know you're charge nurse tonight. I just wanted to fill you in on what's going on. My patient in 10A, Miss Carol Smith, she's here for a left total hip replacement. She's a 36-year-old female, full code. When I first got here at 1600, her dressing was saturated, so I reinforced it. There was a PRN note for that. I rechecked it again 2 hours later at 1800, and she had actually saturated through the dressing and onto the bed linens. I called Dr. Maya to inform her about this. She instructed me to continue to monitor and that everything was okay. I'm really concerned the bleeding is too heavy. What do you think we should do?
All right, so you said the only order you have is a dressing reinforcement?
That's correct.
All right, is she on any fluids?
She's not.
All right, so can you go and check her and I'll call the doctor?
Perfect.
All right, thank you.
Hi, Miss Carol. Just spoke to the doctor, so I'm just going to check your blood pressure and your vital signs one more time. How are you feeling? Good. Any pain? How about the lightheadedness? Is that still there? Has it gotten any worse or just about the same?
It's a little bit worse, actually.
Okay. How about your breathing? It looks like it's picked up. Is it getting hard to breathe at all?
Yes.
Okay. Okay. Give me just a few minutes. I'm going to go let my charge nurse know, and then we'll be right back with you, okay? All right, Andrina, so I just checked her vital signs again. She was complaining about being really lightheaded, and she looked a little pale. Her blood pressure is now 98/69. Heart rate has increased to 105, respirations of 24, and her oxygen has actually gone down to 92%. I'll run in and put her on 2 liters nasal cannula.
All right, give those values to the doctor and I'll get some orders for you.
Awesome, thank you.
You're welcome.
Yes, go.
Hello, doctor. This is Andrina calling. I'm the charge nurse for 2 North. I understand that Nurse Sarah called you in regards to patient Carol Smith, room 10, bed A.
Yes.
She came back from the PACU at 1500 and has a dressing on her left hip. The dressing was reinforced at 1600 and at 1800. The reinforcement was saturated along with the sheets, and I need some orders from you staff.
You know, I already told Sarah after this kind of surgical procedures, we expect bleeding, so just continue to watch the patient closely.
So I'm concerned that the vital signs are trending down and that she has saturated 2 dressings and the bed linen. I'm afraid that the patient can go into shock.
Okay, so I will come and check her. Yeah. So, and then we will see. Okay.
All right. Thank you, doctor.
Sure.
All right, bye.
Dr. Maya, so glad you came. This is Carol. Her most recent vital signs are blood pressure 98/69 with heart rate of 105. Her respirations are 24, and she was at 92% oxygen saturation. So we put her on 2 liters via nasal cannula.
Okay. Hi, Carol. How are you feeling?
I'm feeling really cold and I'm out of breath and I'm dizzy, really dizzy.
Okay. Just let's listen to your lungs and heart a little and see how you're doing. Let's just check your sides. Okay. Just need to put this one and just check your pulses. Okay. So what we need to do, you're really right. This patient can go in shock. So let's put her in Trendelenburg position and put her on 125 normal saline and per hour, and then do just some labs.
Okay.
For like CBC.
Okay, I'll go get the fluids
And
right
then
now.
recheck her more frequently, like in half an hour, and call me if something happening. I will come.
Okay, and just keep reinforcing the dressing?
Oh yeah, reinforce the dressing again.
Okay.
Yes.
All right. Thank you, doctor.
Okay, Carol.